Hello everyone, my presentation is on tuberculosis, which is also known as TB. What exactly is tuberculosis TB? TB is a potentially serious infectious disease that mainly affects the lungs. Globally, it's estimated that TB affects around a fourth of the total world population. It is most prevalent within the third world and developing countries where healthcare access is still a major problem. However, this doesn't imply that developed countries and their population are immune to the disease. According to the CDC, the disease affects around 2.4 individuals per 100,000. TB is caused by a bacterium known as Mycobacterium tuberculosis, classified under tuberculobacillus. Bacteria usually attacks the lungs, but it can also attack any part of the body, such as your kidney, spine, and the brain. There's also two types of TB, one which is active and the other is latent. The bacterium is only visible under high magnifications, where one can see the cell wall configuration of the bacterium, considered a gram-positive bacteria. Some of the common characteristics observed about the bacteria included survival within environments containing oxygen and are often around 2 to 4 microns in length, with a width of around 0.2 to 0.5 microns. Data from the CDC indicates that about a fourth of the global population of approximately 2 billion people are infected with TB. Additionally, about 10 million people develop the disease annually, with 1.6 million dying from it. Data from the organization has also indicated that the disease is the leading cause of death among infection diseases in the world. TB is transmitted from person to person through air, not by surface contact. It is generated by infected individuals through cough, sneeze, shout, or even sing. Droplet nuclei containing tuberculobacilli are inhaled, enter the lungs, and then travel to the alveoli. Tuberculobacilli multiply in alveoli, which is active TB. They have the germs embodied, but your immune system keeps them from spreading, which shows no symptoms, and also known as latent TB. It's estimated that the infectious particles can remain within the air for hours, but this is also dependent upon the climate and the weather conditions. The disease is transmitted only through the air and not by contact, like I mentioned earlier. Upon infection, the bacteria traverse through the respiratory system, entering through the mouth or the nasal passages. They are then transmitted to the upper respiratory tract, to the bronchi, and then later on reach the alveoli, where they can cause damage to the lungs. Transmission of the disease will also vary depending on certain factors such as the susceptibility of the individual or their immune status, the infectiousness of the person with the disease, the environment, and the exposure to the disease. As far as the virulence factors of TB are concerned, an article by Foreled presents a substantive overview. It argues that over the years, the virulence factors of the bacteria that causes the disease has evolved based on the environment of the host immune reaction. Additionally, it's also important to note that the TB is just one of the many variants that can cause the disease, often referred to collectively as the Mycobacterium complex, or MTBC. Nonetheless, the MTBCs are characterized by complex cell wall envelopes that contain remarkably low permeability. These organisms also present characteristics that indicate differential staining procedures. The various species of the bacteria have slight differences in their pathogenicity and genomic orientation, and as the article indicates, they're often classified based on 14 different regions, referred to as RDI. Cigarette smokers are at greater risk for both TB infection and progression to TB disease. People with medical conditions such as diabetes, HIV, substance abuse, and immune-compromising illness or kidney disease are at increased risk for getting active TB disease if they have TB infection in their body. It's also caused by increased immigration, spread of multi-drug resistant TB, and spread within correctional facilities. Since TB does not homogeneously affect the population, selected high-risk groups should be identified in all settings as they deserve special attention and should be addressed specifically with additional interventions. TB is mostly a poverty-related disease. This can explain its uneven distribution in different population groups. Poor housing and environmental conditions, food insecurity, financial difficulties, illiteracy, unfavorable psychosocial circumstances are among the major determinants of TB and contaminantly affect the capacity of sick persons to access healthcare services. Well-defined vulnerable groups include people living with HIV infection, prisoners, homeless people, migrants, refugees, and substance or heavy alcohol users. Besides the increased risk of exposure to tuberculosis, vulnerable groups are also most likely to progress to active disease once they're infected due to the immunocompromised status of their underlying condition. Moreover, in some of these groups, TB may remain for a long time undiagnosed, thus representing a source of infection for the entire community. When it comes to the signs and symptoms of TB, some are common and others can be classified under others. These common symptoms include bad coughs that last for 3 weeks or longer, pain in the chest, and coughing blood or sputum. In addition, other symptoms may show as weakness and fatigue, loss of weight, loss of appetite, fever, and sweating at night. It can also affect other parts of the body, and this may also represent other symptoms that might be specific to those body parts. In other cases where a person has latent TB infection, symptoms may not even appear. Neither do these individuals feel sick, and they cannot spread the disease to others. The stages of TB or discourse can be classified into 3 major categories or of progression. Within the first stage, the early infection, an individual comes into contact with the host carrying the bacteria. Infection of the disease in this stage will greatly rely upon the strength of the immune system of the individual, where if it's strong enough, it'll fight off the infection. Studies indicate that around 70 to 80% of individuals who come into contact with people with TB often have strong immune systems that can help them fight infections. The diagnosis for TB will be the lymph nodes for swelling, the skin test, blood tests, imaging tests, and sputum tests. The doctor will also use a stethoscope as part of the physical exam to listen to the sound of the lungs when one is breathing. In addition, there's also a variety of tests or tools that can be used to evaluate whether one has TB or not, with the most common being the skin test. With the skin test, a small amount of tuberculin, a substance used in the testing of TB, is injected below the skin on the inside of the patient's forearm. It's then checked after 48 to 72 hours with a slight swelling, indicating whether one has TB or not. The treatment for TB would be antibiotics for about 6 to 9 months. And the list is the isoniazid, the rifampin, ethambutol, rifamycin, pyrazinamide, among others. The mode of administration will also rely upon one's resistance to drugs. In scenarios where the bacteria are resistant to drugs, a combo of both pills and injections may be advisable. Therapeutic drugs may also be used in combination with these drugs. Some of the common side effects that may be experienced include nausea, vomiting, appetite loss, jaundice, dark urine, and blurred vision. Completion of the drugs is essential as it may create a problem if the bacteria become resistant to a certain drug. Prevention of TB can be undertaken using vaccination, keeping your immunity high, maintaining good hygiene, and medication adherence. If you have active TB disease, you must get treated right away. This might involve taking a number of medications for 6 to 12 months. It's important to take all of your meds as they're prescribed the entire time, even if you feel better. If not, you can get sick again. Keep all your doctor's appointments. Always cover your mouth with a tissue when you cough or sneeze. Wash your hands after coughing or sneezing. Don't visit other people and don't invite them to visit you. Stay home from work, school, or other public places. Use a fan, and importantly, open windows so the air can move around and get you fresh air. And do not use public transportation if you have active TB. Thank you.